Hey everyone, it's Drew here at IM3. I'm joined with Dr. McCollough again. Pleasure to see you.
Thank you.
Always a pleasure. We had a great conversation last year.
Yes, we did.
Let's start by talking about the difference between this year and last year and how this show has progressed over the years.
Well, this show has now been going on over 20 years, and I've been a part of it for most of that 20 some odd years, and I see it improve every year. Some of the same people come back, but they come back with new ideas, different ideas. So it really would behoove an individual to make this an annual event for their continuing education, because they'll pick up on new techniques. Will be able to affirm some of the things that they've learned in the past. And one of the things I like about the meeting is also that you develop somewhat of a fraternity or group, a brotherhood of people who are teachers, and the ones that come back, you get to know those individuals.
Of course.
It gives you somewhat of a home in the field of facial aesthetic surgery.
Cool. Well, talk to me about then the first one. So what number is this for you?
Oh, at least 20.
Okay, so what was it like?
It started out, this meeting started out as a multi-university course that Dr. Langston, it was his brainchild, and the meeting was generally moved from one medical school to the other, one residency program, otolaryngology residency to the other. And then someone there would host it, and Dr. Langston would help put together the program. And it was originally started for residents, to start at the basic level and then move up. But over the years it's grown to the point to where it got to be so large that it really didn't make sense to just move it from one university to the other. It felt like that we needed to establish a venue. And it was held in Atlanta for several years, and then 2 years ago moved here to New Orleans. And so at least for the present time, New Orleans is this meeting's new home, and it's identified with the meeting. And I think that gives it some identity that people can relate to.
Well, it says a lot about the association and the people that attend and what they believe in the meeting, since it's been going on for so long, Well,
it's also a multi-specialty, a multi-discipline program, in that we have all the core specialties, of course, facial plastic surgery, dermatology, and ophthalmology. So we have experts from all of those fields, and you get a good cross mix of ideas and concepts and techniques. So that's another big advantage of this meeting.
Well, talk to me a little bit about being able to work with colleagues that are in different specialties and have different approaches to maybe doing some of the same things, and what you gain from that.
Well, it expands your knowledge, and you always pick up one or two new things. And one of my teachers, Dr. Jack Anderson, who was from here in New Orleans, he used to say, if you go to a meeting and you only pick up one thing that makes life better for you or makes it better for your patients, it's worth going to the meeting.
Sure, I like that.
And I can assure you, if somebody comes to this meeting year after year after year, they're going to pick up more than one thing that'll help them.
I like that. Okay, well, let's talk about, you had 2 presentations, right? You want to talk a little bit about?
I've had 3 already, and I have one left.
Oh, wow, so four together.
Yeah.
You want to talk a little bit about the one you did today?
Well, the one I did today was on blepharoplasty, but really plastic surgery around the periorbital area, because it's very difficult to talk about eyelids without talking about eyebrow.
Sure.
And it's very difficult to talk about rejuvenating the skin and around the eyelids without talking about skin resurfacing. And so it really gets to the point of where blepharoplasty is really part of the periorbital rejuvenation process. And so, I worked in a little bit of facelifting and chemical peeling and dermabrasion along with that talk.
Okay. So that's kind of a theme I've been noticing too, is where whereas maybe in the past it was you were doing something with the face and it was just one procedure, but now it's kind of a combination of the non-invasive, the more surgical stuff, and putting it all together to kind of create the best outcome.
That's what the meeting does, because the meeting has 3 tracks. One, of course, is the surgical track. And that's just primarily about the surgery, the cutting and the sewing, and a little bit about the postoperative and preoperative management. And then you've got the non-invasive track, injectable therapies, skin resurfacing, those types of things. And then you've got the marketing side of it and the administrative management side, which gives someone an opportunity to move between those 3 tracks. The other thing I like about the venue of this program is that you can bring your office staff And I did this year bring one of my office staff, and they can sit in and learn how other practices do things,
Wow.
both
Yeah,
from a
that's-
marketing standpoint, how to use the internet, whether or not you need to reach out to a consultant,
Yeah.
and what you can do to improve your practice,
Right.
both from a marketing standpoint as well as from a management standpoint.
Yeah.
And yesterday we had a real treat. T. Martin, who is the owner manager of Commander's Palace, a very, very successful restaurant here in the area, and almost anywhere you go,
We have reservations for that place.
Well, it should be an experience.
I heard it's amazing. Yeah.
Because if you heard her talk yesterday, next time you go there, you pay attention to the wait staff and see how they implement the things that she talked about. It was just remarkable.
I heard about. I didn't get a chance to see that presentation, but I heard someone saying they were bringing, and obviously it was her, bringing someone from the hospitality, more restaurant, and talking about how you can incorporate some of that stuff.
Because it's so apropos.
Yeah.
Because service is really part of what we in aesthetic surgery anyway do.
Right.
And it's how you make the patient feel. It's about their experience when they come to see you as to whether or not they're going to feel good about coming back.
Yeah.
And so it was an ideal bridge between the hospitality, restaurant business, and aesthetic surgery. So
Beautiful.
I thought, once again,
I like that.
Once again, the course directors made a great decision by bringing her in.
Yeah, cool. Okay. Well, last question then. Where do you see this industry of aesthetic medicine going in the next 10 years?
I think it's going to continue along the lines that we've seen over the past 10 years.
Okay.
Of course, as medicine becomes more structured, managed by government, it's making it more challenging for a lot of surgeons to live the lifestyle that they are accustomed to living.
Right.
And we're seeing more and more people from the various disciplines move into the fee-for-service industry of part of medicine.
Yeah.
And there, in that, of course, is aesthetic surgery, injectables. I mean, you're seeing dentists doing injectables. You're seeing family practitioners, family medicine doctors, OBGYN doctors moving more into the aesthetic field.
Right.
And I think we're going to see more and more of that. I suspect, and this is something that I wrote about in the 1980s because I could see it coming.
Yeah.
Ultimately, America is going to have a two-tiered healthcare system. We're going to have the single-payer system, so to speak, which means the government. It's socialized medicine. But we're also going to have the concierge element of it. And that is where patients choose their doctor, pay the doctor a little bit more, but they get the service that they're looking for.
Right.
And I see that concierge part of the practice moving upward almost on an annual basis, and frankly, that's what aesthetic surgery is. It's a concierge medical practice.
Okay, interesting. Have you had paid any attention to recently the bigger companies like Amazon and Berkshire Hathaway getting into kind of their own healthcare? Have you heard anything about that?
Bits and pieces. I really don't know enough about it to comment, but everybody wants to get in the healthcare business.
Right.
And not necessarily to be a provider, but to control it.
Sure.
And so it's just amazing how doctors are losing more and more control of our destiny and healthcare destiny and our ability to take care of patients because everybody else is getting into it, and we aren't united enough to be a force. And the AMA, unfortunately, has not done a very good job representing doctors in the National Health Insurance Program. And I don't think that they're going to be very effective going forward, frankly, because more and more of my colleagues are resigning from the AMA because of that fact.
Yeah. Okay. Interesting. Cool. Well, thanks for sharing your perspective. Always
It's always
a pleasure.
Yeah. Thank you very much.
Yeah, you're welcome.